and welcome to AgeWise Health. I'm your host, Madeline Didi. On today's show, we are hosting Dr. Dawn Thomas of Dawn Thomas Physical Therapy. Hi, Dawn. It's great to have you on our show today.
Thank you so much for having me. I appreciate it.
Yeah, absolutely. So, can we hear a little bit about your background and how you got started in physical therapy?
Sure. So my interest in physical therapy began as a teenager from sports and kind of learning about the body through sports and exercise and having my own injuries, and was plagued with some knee injuries at that time, and had a good experience with my physical therapy, and I thought, well, this is something I could do. So that's kind of how I got into it. And when I started, I've been a physical therapist for 30 years, and a lot of that time has been working for hospital systems and working in different hospital-based environments. And 5 years ago, I branched off on my own to do my own business, and I do concierge mobile physical therapy and wellness with people in their homes. So that's what I do now.
That's great. Yeah, thank you. It sounds like you have a very extensive background in physical therapy. So to understand a little bit more about the role that physical therapy plays in, recovery and healthcare, could you tell me a little bit more about why someone might consider physical therapy instead of other imaging or tests when maybe they're faced with an injury?
Yeah, so the whole issue or notion of getting imaging and tests is an interesting question to ask me, because I feel that as physical therapists, we have a different perspective on evaluating someone before injury and after injury. And a lot of times people come to me with imaging reports, and they're kind of really anxious about this MRI report that they got. And then when I talk to them about it and educate them about what it actually says and what it actually means, they have a much better understanding of how you can do images on people who feel good, and the image shows lots of problems. And then you can do images on people who feel terrible and have lots of pain, and it looks like there's no problem. So having an image done doesn't always correlate with someone's function. And so as a physical therapist, when we evaluate someone, we're able to evaluate their function and see if it correlates with those other findings. But sometimes people don't really know that as physical therapists, we can receive someone as the primary entry point into healthcare. So people don't have to have a doctor's prescription to be evaluated by us, and they don't have to have permission from their insurance company to be evaluated by us. So it's something that most people don't know, and we can evaluate their function, their musculoskeletal system, and come up with what we call a physical therapy diagnosis, and help them determine if they need imaging or if they need further medical evaluation, and kind of guide them in that direction if that's where they need to be.
Okay, great. Yeah, that's really interesting. So with your experience, is there any certain conditions that you find really benefit from working with physical therapy?
Well, when we talk about the term condition, one of the things I'd like to point out is that as a physical therapist, we can help someone who doesn't have a condition. So we like you to perceive us as somebody who can help evaluate your function and your wellness before you have a condition or a problem that you're worried about, or a pain problem, or before the issue happens. So you could think of us as somebody that could do an annual functional assessment with you, and you would get an idea of what issues you might think about addressing before they're a problem. Things like posture and balance and strength and endurance. And these are the things that I might assess on someone when they come to me. I want a checkup. I want a physical therapy checkup. And so we do what we call a wellness assessment, and then we can, with some degree of predictability, see where there's potential issues with imbalances and help people kind of get in the right direction along those lines. When we're talking about conditions, the other sort of conditions that people maybe don't think of physical therapy for are the common metabolic conditions that are so common, like the diabetes and the heart health and obesity and arthritis, and a lot of these big categories of conditions, neurological conditions, strokes, like these things that a lot of people deal with, we are well equipped to help people, guide them on how to integrate exercise into their life in a way that can help those conditions and manage those conditions.
Okay, absolutely. So I know you said that there's wellness and then there's also the condition side of the physical therapy. So when you're looking at that, who really benefits from physical therapy? Is it a wide range of people who can benefit from it?
Well, we like to think anybody can benefit from physical therapy.
Yeah.
And the traditional approach has been after injury. And that's one of the reasons I love how I've approached what I do now. And because I'm able to talk to people about their wellness, and people are able to access my information and my education in terms of being well and living well longer, not being reactive to an injury. And that's really rewarding for me, to be able to talk with people about their goals that are beyond rehab, their goals that might be, things like being able to tolerate a long hike that they're traveling for. That seems to be one that comes up frequently. So people knowing that they have some orthopedic issues or conditions or arthritis or other things going on, how can I help them prepare for this big goal that they have that's more would be a performance goal, to be able to hike this particular trail with a particular weight and have fun doing it.
Yeah, absolutely.
Yeah.
I mean, it sounds like there's a lot of benefit there that can come from it.
Yeah.
So I know we talked a little bit about what types of, anyone can benefit from physical therapy. So how do you see that physical therapy helps people prevent any injuries or health issues before they even start?
Yeah, I think the key to this is education and kind of changing the paradigm of our culture, really, for people to be seeking out education for prevention, and I feel like it is shifting. Like in my career's lifetime, I think there's definitely been a shift in people being more proactive and understanding how to be healthier, to be preparing for longevity and not being reactive. But I lost track of the original question. But so being preventative helps people. Yeah, I kind of lost track of
That's
how
okay.
you phrased it.
I was talking about how does physical therapy help prevent issues in health before they even start?
Yeah, so the education piece. So knowing, and that's why. So I feel that as a physical therapist, our profession itself needs to be more proactive in educating the community and being a part of community resources for people to understand what it is they can do to prevent these things.
Yeah.
By things could be anything from dementia, Alzheimer's, falls, arthritis. All of these things are things that we can play a role in preventing. So if we can interweave ourselves in the community more and in where people are receiving information, then we can have a bigger impact.
Yeah, absolutely. That made me think of, how do you think that staying active is really important? I know you mentioned talking about going on hikes and preparing for things like that, especially with an aging population. So how does physical therapy and then staying active help benefit overall health?
When we talk about staying active, when I'm educating people about staying active, everybody perceives that as a little bit different, and the key is kind of meeting people where they are and understanding what they find joy in, and leading them in the direction of finding something active that they can really integrate into their life. Like, being active should not be a chore. Being active should not be a punishment. Being active should be joyous, and we should find joy in movement. And so when we're talking to people and problem solving, how can we integrate more movement into your life? We're trying to find what are your interests, what moves you, what makes you feel good, what makes you interact with your family more, what makes you interact socially more, and kind of like interweaving these things so that you can genuinely integrate the activity into your routine, and it just becomes a part of your life. It doesn't become this scheduled thing that I have to go to the gym. That's not what it's about. It's about integrating movement in a way that's meaningful to you.
Yeah, absolutely. Would you be able to give me some examples of what maybe some non-typical movement would look like in incorporating that into your daily routine?
Absolutely. So a lot of times when I'm teaching, well, I'll give you a few examples. A lot of times when I'm teaching exercises that are specific to someone's deficits. So maybe I did an assessment and I found that there was a balance deficit. I'm gonna find some things that the person can do that they can integrate into their day, their normal everyday habits. So standing on one foot while brushing your teeth is one example. So that's a way to make the exercise a part of your day. It's stacking the habit to make it automatic for you, and you can make some significant gains doing it. Another one might be playing with grandchildren. So making play with grandchildren your exercise for the day. So and making sure that, say, getting up and down off the floor is part of that play. So if you're not getting up and down off the floor effectively and safely, then you're not going to engage in that play as much. But by doing that, people might think, okay, that's not exercise. But sure, you can integrate the walking and playing and throwing balls and kicking balls and getting up and down off the floor and crawling and getting into different positions. All of these things are exercise. That's movement. So that would be an example that someone might not think is a traditional exercise.
Sure, absolutely. When it comes to older adults, I know you mentioned like playing with grandchildren and things of that nature, incorporating that into your daily routine. Is there anything that you see a really great success rate when it comes to movement for older adults and just keeping them active?
Yeah, I think, again, really the key is understanding what success means for each person. And, success for one person, that's really where, when we're goal setting with people, that's a lot of education and learning the person about what's important to them and what's meaningful to them. And then from our expertise, understanding what's realistic and what's holding you back from that goal. Sometimes there's factors that are super physical, like you don't have strength in your quad to press up off the stair or whatever it might be. And sometimes it can be things like fear of falling, and those are things that we address as well. And so when we work with the person that closely to be able to set the realistic goal, break down why you're not doing the activity, then we can make a plan that's successful to them, that feels successful to them.
Wonderful. Yeah, absolutely. So to kind of stay on that topic, but change it up a little bit, how do you think that physical therapy helps support independence, especially for maybe older adults that want to stay in their own home as they continue to age?
Well, when I think about the different categories of typically what I'm teaching someone to do, I mean, when it comes down to the actual exercises I'm teaching someone, it's things like strengthening, cardiovascular endurance, flexibility, and balance. So those would be the kind of main categories of things when it's really all said and done. And you need all of those things to be independent and living well in your environment. Mm-hmm. So if you are committed to being independent in your environment, if you have a routine that you're incorporating those things, then you're going to maximize your independence.
Yeah, absolutely. And then do you have physical therapy services within someone's home? Is that something that you offer?
Yeah, so that's actually the main focus of what I do. So we're a small group of doctors of physical therapy that provide in-home concierge mobile sessions, private sessions that are both skilled physical therapy and wellness related. And by that, I mean the skilled part of physical therapy is when there's a medical diagnosis or there's a pain issue or maybe they had a stroke or they have a knee replacement or they had surgery or they've been hospitalized for some time and they're trying to recover from a hospitalization. Could be an orthopedic problem or a neurological problem. Those are more traditional situations that physical therapy we do sessions with. And then there's the more non-traditional clients that are working towards the big vacation on the mountain, or working towards trying to learn more about their bodies and trying to learn how to exercise to prevent dementia and prevent Alzheimer's and maintain their strength and muscle mass while they're aging.
Yeah, absolutely. Given the modality of your business, and I know you said when you were talking about your background earlier that you have experience in a lot of different areas of physical therapy, have you found that there's a benefit to having this take place in someone's home or in your mobile clinic versus going to maybe a facility?
Yeah, so there's different advantages to different scenarios, and one of the things that we love about going into people's homes is that we kind of see them in their own environment, in their own little ecosystem. So it's a couple of examples I can think of off the top of my head in terms of solving a problem. So I'm working with a patient who had a neck issue, severe pain in the neck. And I'm problem solving to reduce her pain initially, because that's usually the main focus when someone calls me with pain, right?
Absolutely.
Let's reduce this pain. Then we get into the conversation about, like, why is this happening? Mm-hmm. And then I have her take me to her home office. And within 30 seconds, I can see immediately what we need to adjust and make an adjustment of how she's got the keyboard here and the computer here, and her neck is here for a lot of minutes at a time. And so right away we can make those adjustments and kind of solve that issue quicker than if we're not right there. Another example, totally different scenario, a neurological. This adult had a stroke, and she was having trouble getting out of bed. So with her current level of strength and function, just observing like how she was getting out of the bed was definitely some safety issues, relying on furniture and kind of maneuvering in a very unsafe way. Not by changing her whole function, but just by teaching her a different technique and a different way of moving her body and her legs. We're able to, right then and there, get her in a much safer strategy to prevent any further injuries or any further trouble. So being there in that environment and being able to assess the environment so quickly is really helpful.
Yeah, absolutely. When we talk about, you gave a couple of examples there, patients who have experienced an injury or are coming in for some sort of physical therapy rehabilitation to try and get better. Have you seen a high success rate with your patients and the exercises and practices that you do with them?
Yeah, and that's my favorite part, right? When I see people progress and celebrating those wins, and they're all so different, and that's part of also what I love about what I do. I'm not pigeoned into one sort of category of client. Having And also this goes down to making realistic goals. But seeing a patient go from, like an example I can think of now that I'm working with, a woman that I had met about a year ago, and their family had me start with her after a hospitalization, very debilitated condition, difficulty transferring or even standing. And a year later, she comes to our community balance classes, independently walks with no assistive device, community ambulator, socially interacts with everybody, and she's really engaging with life and maintaining her independence. And it's so fun to see that.
Wow, that's amazing. It's
Yeah.
wonderful to hear success stories like
Yeah.
that. What piece of advice could you offer to anyone who's thinking about starting with physical therapy services?
I think my advice is to be open-minded to what a physical therapist has to offer. You don't have to be injured to learn from a physical therapist. You don't have to have a problem necessarily that you are aware of to gain some knowledge from a physical therapist. And the other thing is, don't make the assumption that your previous experience with physical therapy is going to be the same as your future experiences with physical therapy. everybody's different. Everybody has different needs, different experiences. And, if there's something that you're interested in learning about your body, that's what we're experts in movement, and that's what we do. So if you haven't gotten a problem solved, don't give up. Keep seeking out the next physical therapist that might help you solve that problem.
Yeah, absolutely. If anyone wants to learn more information about, your services, physical therapy in general, where could they look to find that information?
Well, the best place to start to learn more about me and what we do is DawnThomasPT.com. DawnThomasPT.com. And you can learn a little bit more about me and my staff and some of the services that we provide.
Wonderful. Great. Thank you so much. It's been great talking to you today, Dawn. I feel like we've learned a lot. And thank you for your time here. I've had a great time talking about all the things that you have to offer and learning a lot more about physical therapy and the benefits that it can have for such a wide range of people, even more than I would have thought. So thank you for your insights.
Well, good. I'm glad to hear that. Thanks so much for having me.
Absolutely. Thank you for joining us on AgeWise Health. I'm your host, Madeline Didi of Ameristaff Nursing Services. If you have any questions about today's show, please feel free to give us a call at 248-288-2270. Stay safe and healthy.